This is breaking news.
Right now, Governor Kathy Hochul is making an important announcement in New York City. Let's go to that now.
Is also here, the director of women's health programs for Long Island Jewish Medical Center. We'll be hearing from her, as well as the room is filled up with amazing individuals who represent, whether it's Planned Parenthood or healthcare organizations that are providing abortion. We just had a very productive roundtable, and I'll recap that in a few minutes. So that's what we're going to talk about. But first, COVID continues to be ever present. This is something that we had talked about in the past, about doing everything we can to be prepared for new variants. And we just had a meeting on that issue as well this morning, as we're having regular updates on what is going on. The new very contagious variants, BA4 and BA5, are very much around us. Now, you look at the numbers. We track the numbers all the time. We're at about 33 per 100,000. Which is not that much higher than it was a month ago, 26 a month ago. Here in New York City, though, it's 45 per 100,000, and a month ago it was 38. So we're still trending. We'd gone down, going back up again a little bit, but we also track hospitalizations. I mean, I want to know how many people are being hospitalized. How severe is this? Is it a nuisance? Is it a real problem? Are people dying? People being hospitalized? And so the number on that, the hospitalization, the 7-day average for hospitalization, really is just about what it was a month ago. It's about 11 right now per 100, or 11.2%, 10.6 here in the city and in the state. So we're not doing poorly in that front, and thankfully the deaths remain very low, and that is something that is important to us. So again, we know what to do. Vaccinations, and about 78% of New Yorkers of the total population eligible are fully vaccinated. Always can do more on the booster front. What is your excuse? They're available. 53% of New Yorkers have been totally boosted. So we've made real efforts, we've made real progress, but I'm also going to talk about the fact that treatment is important as well. I mean, people who contract COVID also are eligible to receive therapeutics now. That is a good thing. We didn't have that early on. So to just lessen the severity, lessen your symptoms, and just get you through it, we have therapeutics, but a lot of people have barriers. They don't know where to get them. You know, what is this all about? And a lot of people just don't have a regular health care provider in the state. So yesterday, proud that we launched a new free hotline, so every New Yorker can contact one of our treatment centers here in New York City. You have a phone number, 212-COVID-19. That's clever. And outside of New York City, it's 888-TREAT-NEW YORK. So that's available 24 hours a day, 7 days a week. So if you test positive, we have a lot of test kits. I know because I ordered 92 million of them. We have plenty of test kits in our state. We also want to let you know that there are therapeutics that can help you get through that. That's what I availed myself of, and I didn't have too many symptoms when I tested positive on Mother's Day this year. I'll never forget that. So we have the phone numbers for you there, and also I want to thank New York City Health and Hospitals for their partnership. We're also launching a media effort, $1 million, a paid media effort to let New Yorkers know the facts about COVID still. Don't be immune to this. It's still ever present. Also, the options they have for treatment. It's running in English and in Spanish, TV, radio, online. So we're reminding everybody it's summertime. The numbers tend to go down a little bit more in the summer when everybody's outside. And fall and school are just around the corner. So parents, things have changed since your kids may have been in school, and now children 5 and up can get that shot. We're working on younger children. So please get your kids vaccinated before they go back to school in the fall. We just want to get through less disruptions than we've been experiencing. And so it's still with us. We're on top of it. We're not changing our policies at this time, always reserving the right to do so. I will always reserve the right, but right now we just want to have people be smart, and would recommend in various settings, including transportation. We want everyone to wear a mask on their public transportation. On the trains and on the subways. So let's stay on top of that. And then, of course, when we're dealing with COVID, our Department of Health isn't busy enough. We're now dealing with, as we talked about for a couple weeks now, monkeypox. Total cases statewide is 238. They are very concentrated in New York City. Of course, we have a website to get information. but New York City has 223 of the 238 cases. Westchester has about 7. Sullivan, Chemung, Rockland, Suffolk has 4. The first 3 have 1. Nassau County has 1. And so it's something we're concerned about. It's rare. It's a viral infection that does not usually cause serious illnesses, but rarely fatal, but it's very unpleasant. You can end up with permanent scarring as a result, extremely painful. So at this time, no deaths have been reported from monkeypox. We hope that stays the way it is. But I did talk to the White House about this, Dr. Jha, who's leading the response for the White House, and I said we need more treatment, we need more vaccine allocations here in New York State. I pointed out that we have vulnerable populations. We have a lot of activity out in places like Long Island, Fire Island. We have a lot of concern about some of our neighborhoods. So last week the federal government gave us 8,915, I believe it was. They gave us case, and I said, okay, we have a large population, but they're limited as well. Apparently there's one provider. It's in Europe, supply chain issues, so I heard all about it, but they expect to get a much larger supply in the near future. I think it was a quarter million doses for them. And I'm pleased to announce today that the DOH will be distributing an additional 5,180 vaccine doses. About 1,750 will go to Suffolk County. I know Northwell has set up a facility on Fire Island. Appointments are currently full, we're told, but we encourage local residents to keep checking. About almost 1,500 to Westchester, 1,200 to Nassau, and 620 to Saratoga County. So we're tracking our vulnerable areas. We're getting the doses there based on smart allocation, but we truly, truly wish we had more. New York City received their own allocation from the CDC, about 14,500. That's good news. And I know that New York City will be releasing more appointments at 1 o'clock today. So if you've been waiting, check in at 1 o'clock. So that'll allow more people to, have access to it. But if you suspect you have it, make sure you see your provider. It is contagious. And we also launched a public relations or public education campaign about this. But what I've conveyed to the White House is that we've received about 14% of doses allocated nationwide, but we have more than 14% of the nation's cases, so we're going to continue to press for more doses so we can continue to be on top of this as well. Thank you, Dr. Bassett, for yet another healthcare crisis, but you're up for it, and I thank you and your entire team for what you do. So speaking of healthcare crises, this one's hard to still talk about. The realization that with the reversal of Roe v. Wade just a short time ago, they stripped away the rights of millions of women. It is hard for me to stand here as the grandmother of a 2-month-old and realize that my granddaughter has fewer rights than I had. That was never the trajectory of our country. Rights were always expanded. And now we have a different dynamic. So, but we fight back. New York State, we're not going backwards. And I made a promise to New Yorkers and women all across this country. Any woman in need of health care, reproductive health care, will be welcome with open arms here in New York State. And I intend to keep that promise. We talk about our history. 1970, 3 years before the rest of the nation, a Republican legislature, I love to point that out, a Republican-dominated legislature, Republican governor, ensured that women had the right to reproductive decision-making over their own bodies. They had control back in 1970, 3 years before the rest of the nation. In that time, women across the nation in search of health care, reproductive health care, came to New York. We had over 400,000 abortions were provided, 2/3 of which were to people out of the state. So why do I tell you that? Well, fast forward to 2022. We may be in a similar situation. In fact, we are in a similar situation where, as we call around and talk to providers around the state, places like Western New York are seeing a major increase in women from Pennsylvania, which has more restrictions. Ohio, we're seeing a surge of cases from elsewhere. They're coming now to our providers. And we saw this, we knew this would happen, not just from 1970, just common sense told us they're going to come here. And so right before as I mentioned before this press event, I had the opportunity to meet with some of the leaders in this, and we talked about their challenges and the conversations they're having with providers and their contemporaries in other states. And there's a lot of fear out there, a lot of anxiety, and fear of legal prosecution. So we raised some issues. We talked about some issues about training. For someone being trained in the medical profession in some of those states, part of their residency training means that they would have to be, performing abortions, have exposed contact to actual live patients, not just in a textbook. And what role can New York State play in helping continue people's education? What other role can we play in people who now, and there are cases where people have had to close their practices in other states because there's not going to be any more patients, welcoming them here to the state of New York. Are there barriers to that? If there are barriers, what are they? How we get through them? Certification from state education department, conversations with them about how we can reduce some of the barriers for doctors who are in other states that are seeking to continue their work. So these are the individuals on the front lines, and I thank you for what you've done, and we're going to continue the conversations. We had our first approach, but we're going to continue refining New York State's response in light of more information and more data, and making sure that we are always here to ensure that we're doing everything possible. And part of that was funding. We announced this early on, before the decision was clear. We saw their intent was telegraphed with the leaked memo. We had over $35 million, and that's from Commissioner Bassett's funds, $10 million of which is for security. That's a no-brainer. We know vulnerabilities. I'm from Buffalo. Dr. Bernard Slepian is still very much in the hearts and minds of people who live in Western New York. So we know there's vulnerabilities at facilities, people's homes, and so we're prepared to protect people with security. $25 million also to launch the Abortion Provider Support Fund, the largest of its kind in the nation. And so our conversation today was about how this can be used to help people. So today we are announcing the first $10 million of actual grants to the providers, where they're going, and those will go to 13 organizations with 63 facilities and clinics across the state. And many of them were represented here today, talking about how they're going to be able to do more hiring and expand their operations and how they're anticipating this. So now it's official. As of today, the first $10 million is out there. We want them to hire more people. And as I heard today, great appreciation for this funding, but we appreciate what you're doing. And it's a shame we needed to do this, but we did it. And again, that's part of our effort to be proactive and have provider-centered.